A very good morning, everybody, and thank you for joining us for this live today. We did meet last Sunday as well, and like I did mention, that every Sunday we are going to be joining you at 11 a.m. For what we have introduced as the AM MedTalk series. I am Shriyal Setumadhavan, the editor of Aesthetic Medicine India, and I'm delighted to connect with aesthetic medicine practitioners, have them join us, or subject matter experts in this field, to join us every Sunday morning at 11 a.m. for an AM Med Talk. So today we have a very special doctor joining us. The reason I call her special is because she has been supporting aesthetic medicine for a while now with her insights, with sharing her experience and her expertise. And if you have been reading our magazine, Aesthetic Medicine India, very regularly, the link would still be available in our bio link at the moment. So if you've been reading the magazine regularly, you would see a lot of inputs and insights coming from her there as well. She has also been a speaker at our conference that we hold every year, the Aesthetic Medicine India Conference and Exhibition. This year we had the event in May, and it's again scheduled for May in the next year. So I am speaking about Dr. Geeta Patel. She is a dermatologist and cosmetologist of Zara Skin Clinic, Ahmedabad, and she's going to be joining me in today. So I can see Dr. Geeta, I have received your request. I am just accepting it. All of you watching us have already uh, subscribed to or have checked the digital edition of our anniversary issue. We are celebrating our 5th successful year in India. So, Dr. Geeta, what I will do is let me try to send you a request instead. I have sent you an invite. If you have received it, and can please accept it and join. So we've already started planning. Hello, Dr. Geeta. Good morning. I am unable to hear you. Yes, I think I could hear you now.
Yeah. Can you hear me?
Yes, I can. Thank you. Thank you so much for joining us for this live today. How is the weather in Ahmedabad?
It's beautiful. It's not, I mean, I know everywhere else it's so bad and it's raining badly, but here it's raining just right. So it's nice and cloudy and we're enjoying it. How about
Wow, wow. So on my side, it's been raining. I think Mumbai is how it always performs during the rains. It's doing complete justice to what it commits to all of us living in the city. But yes, always enjoying the rains, but it's been pouring. Cats and dogs, like we say. So, Dr. Geeta, thank you so much for joining us. Like I was telling all our viewers also, we initiated the AM Med Talk series. For a weekly connect. Of course, you are aware that our magazine comes out once in 2 months. We have a website up and running. We do a yearly conference. But the whole idea of AM Med Talk is, I think, with this industry, with the aesthetic medicine fraternity and so many aesthetic medicine, aesthetic treatments being spoken about, there is so much for us to catch up with every week. So last week we spoke about skin boosters, and this Sunday, Dr. Geeta has joined me to discuss toxins. So we are going to be speaking about toxin transformations, how it transforms us as people, and how there are transformations in the application of toxins. Am I right, Dr. Geeta?
please, Shreya?
Perfect. So I will go straight with my questions, but for everybody watching us, feel free to use the comment box. I have kept it open. You can put in if you have any questions over there, if you think I have missed out on something in my questions, and we would be happy to take it up in this live. So, Dr. Geeta, before we get into the transformation part of toxins, if you can list the most common applications of toxins in aesthetic medicine.
So, it's been there 18.
Dr. Geeta, sorry, your voice is coming and going blank in between.
Can you hear me now, Shreya?
Yes, yes, I can. I can.
As I was saying, I've been doing toxins since last 20 years now, and it has evolved greatly. So, we started out most basic indications, which happens to be the crow's feet, which are the lines near the eyes and the glabellar lines and the forehead line. So these three are the most, still the most basic indications for toxins. But in these 20 years, we've seen a huge evolving era of the toxins, and it's used in various indications. And I think you're going to take them up one by one.
Yes. So then let's dive deep to the newer applications and how are toxins being used for enhancements in areas like the nose and the neck, and are there specific techniques involved?
Yes, so although if you just see the videos, it might look very simple and easy, but you have to, as a dermatologist, we have to get our anatomy very clear. Anatomy should be absolutely, it should just be point blank. Otherwise, you just may hit some unintended muscle, and we have to remember that this is not reversible. Like how fillers is reversible, you don't like it, you could high lace it and there you are back to square one. But this, you have to wait for the toxin to wear out, so that can take about 4 to 6 months. So that's why it's absolutely essential that you get your anatomy right before you start being an injector. So the question.
Ye- Yes. So I was asking how they can be used to enhance areas like the nose and the neck. So I'm going to go on different areas. I'm starting with the nose, then we'll move to the neckline.
Nose, now we do, because some people, they get a flare of the nostrils, when talk, so and they don't like it. So it's like you could use it for many indications, but this is a very personal indication where the person does not want the flared nostril, so we inject it into the muscle which causes flaring of the nostril, the alaquinesi, and it's just two units in each of this muscle, though it is very painful. So we apply a numbing cream. Still, this area is very sensitive, but still that it gives a good result. It stops the flaring of the nostrils. The other thing is, when we age, there is this, the tip of the nose, it goes down, it goes down. So when we inject this muscle, the depressor septi, so you get an upturning of the nose tip, which looks really nice,
Hmm. Hmm.
target muscle which we inject. Of course, it's slightly painful, but it's just for a few seconds. But it causes a non-surgical uplifting of the nasal tip, which gives a very nice profile.
Nice. How about the neckline?
His neck is now booming, because what has happened is, we were all these years focusing on the face, and we actually neglect the neck. Realized is, neck has very thin skin and it can be a big giveaway. You could at 50 look like 30, but what about your neck could give away your age. So now the focus is on the face and neck as one unit. So we tell the patients also, whatever you apply on your face, please don't neglect the neck. It has to be treated simultaneously. So toxins have a great effect on the neck. These are these platysmal bands. I can just do it and show it to you. So these bands, they come up, pull the face down, sagging and laxity, and these jowls in this area. Inject these platysmal band toxins. It smooth up your.
Dr. Geeta, we've lost your voice again, and the network seems to be a bit weak.
Am I audible now,
Yes.
Shriyal?
Yes, yes. You may please continue.
I was telling that these platysmal bands, when we inject, then you get a very high definition of the jawline that happens, and smoothening of the neck. Also, you can also do a Nefertiti lift. In the Nefertiti lift, Nefertiti was an Egyptian queen who had a very nice, long, slim neck, right? So when we inject lower border of
We've lost your voice again. It's blanked out. Is
can
the phone speaker getting covered for any? Maybe if you have rested the phone on something, the speaker is probably getting
yeah, maybe.
covered.
Okay. Yeah. So is that okay now, Shriya?
Yes.
Yeah. So then we also inject in the lower border of the mandible. So in the lower border of the mandible also gives a good definition. Also now there is something called the Barbie tox. So Barbie tox is when you inject the trapezius. When you inject the trapezius, you get a slimmer looking neck. But I think Barbie tox is being abused a lot. So I don't want to encourage that too much, because there are many patients who are just doing it too much, and it becomes a kind of obsession. It becomes a kind of dysmorphophobia. So we as dermatologists should be drawing the line as to what to do, what not to do. And in patients of dysmorphophobia, we have to be aware of what it can lead to. So do it with caution. So this was about the
Nice.
nose and the neck. Yeah.
Okay. So I think you kind of mentioned this, but I'll still go back to it. So between the nose and the neckline, what I see is the jawline, and you also mentioned it. So do toxins also help us define the jawline better?
Yes. So, we also do slimming of the face along with the definition of the jaw. If the patient has, this trend started in the Southeast Asian countries where they have a very squarish face, especially in Korea and China, where they have a very broad lower face. So that happens because you have a very bulky masseter. Masseter is the muscle that helps you in chewing. So what happens is, you could genetically have a very huge masseter, which leads to broadening of the jaw. And in females, in the lower face, if it's slimmer, it looks better. That's the definition of beauty. So when we inject toxin in the masseter, it slims down and gives a slimmer face. So this is also called non-surgical contouring of the face, non-surgical slimming of the face. And you could give toxin over there, and we also give toxin in the jaw, in the lower border of the jawline. So this actually leads to, these two procedures along with the platysma leads to a very good jawline definition and lower face slimming non-surgically.
Nice. Are there any benefits of, using toxins for chin enhancement as well?
Yes. So chin has this muscle called mentalis. So in some people, while they express, when they talk like how we are talking, they get this poppy chin. Poppy chin is like this. You get a dimpled chin and poppy chin, which sometimes does not look all that nice. So we inject about 3 to 4 units on each side of the mentalis, which just smoothens out the mentalis. So earlier, Shriyal, we were just focusing on the lower face while doing
Right.
talks, and the upper face and the lower face was absolutely ignored. So now in this era, everybody treats almost the full face, so gives equal attention to the upper and the lower face while doing the toxin, which gives a very nice overall result.
So how effective are toxins also in treating areas, prone to excessive sweating? So can they also be used, like especially in the underarms or in the palms, where, some people face excessive sweating? Can toxins also be applied to these areas?
Absolutely. So we call this condition as axillary hyperhidrosis or palmar plantar hyperhidrosis, in which there is excessive sweating in these areas. And, this can cause quite a big concern to the patients. There would be limitation in what you can wear because, the stains would be visible, and it causes kind of embarrassment to the patient. So this can be a huge mental concern to the patients, and we get a lot of patients coming to us, especially this kind of monsoon weather, the humid weather, when we tend to sweat more, and it also ruins your expensive clothes, apart from so many other things. So toxin is an approved indication for hyperhidrosis, where we inject tiny amounts in the area, in the axilla, after doing a starch iodine test, so you know exactly how much to inject where. And similarly, it's also injected in the palms and soles, where it can be a huge bothersome problem for the patient, because you can't even hold a pen, you can't write your exams. It can be umpteen number of problems. You can't wear socks, you can't wear shoes for longer periods of time. You can get fungal infections and so on.
How about correcting a gummy smile? Like, I think often we see people facing that challenge with a gummy smile also. So can toxins help with that correction?
Yes. So do have a lot of patients with gummy smile who come to us, when they smile, their gums are exposed, and
Yes.
they don't like it. And sometimes the gums are very dark. So, and when females they apply lipstick, there's a limitation what they can apply. They get caught about the dark. So these all uh, cosmetic reasons, and it's very easy to just put. There are defined muscles which we target the levator lips, inject right, and in about 2 to 3
We
days
lost your voice again. Where you inject?
in the levators of the lip, the muscles
Okay.
which hit the lip. So we inject so that we, when the patient smiles, the gums are not visible. So this is a very easy case for 3 to 4 months. So it's quite so most of the patients prefer this, and the results, according to the papers published, the results done by Toxin much better than the results which we get by a surgical option.
Sorry, one second. Yeah. So we have discussed a lot of applications, and I think a lot of it has been an eye opener for me also personally. So I'm so glad we chose to discuss this topic. What I wanted to understand was that are there any risk associated with any of these newer applications that we just discussed? You know, of the chin, the neckline. Are there any risk associated with it that doctors also need to know, as well as the receiving person, the patient?
Yeah. So, Shriyal, usually in the upper face, where most of the toxins, most of the doctors start doing toxins, most of the indications are pretty safe if you follow the guidelines. But sometimes you do get a lid drop, ptosis when you're doing the forehead. So ptosis you can get sometimes when you're injecting, or when you want to remove all the lines under the eyes. You want to remove all the lines under the eyes, and you inject high amounts of toxin, especially you go further down the eyes into the cheek, and that can actually cause a cheek drop. So you are treating the infraorbital lines, but you can cause a cheek drop because you actually inject the unintended muscle. So that you have to keep in mind. Be very superficial while you inject the infraorbital line. And when we come to the lower face, yes, you have to be really careful because there are a lot of muscles moving, and they're very small, and some are superficial, some are deep. So you should be very clear which muscle is your target muscle. So let's say now, we also do lip flip with toxin, where we inject just 1, 2, 3, 4 units, one unit each, to upturn the lip and to give, like, as if it's like a voluminous lip or a fuller lip. But that sometimes can also cause the lip to drop, the smile to get, the patient is not able to smile. And sometimes, when you want to lift the smile, you want to correct the DAO muscle, you want to hit the DAO muscle, then also sometimes, that's very common. Then the smile gets twisted, you're not able to smile, or one side you can smile, the other side you can't smile. So you have to be really careful while doing the lower face. Once, for my patient, I was doing masseter, I'm talking about years back, and she was a very nice patient of mine, and we were doing masseter. And now there are boundaries defined for masseter, but earlier there were different boundaries, and I hit the risorius is the muscle that makes you smile. So on one side, she couldn't smile, and the other side the smile was going way up. So it was like a kind of a lot of problem for my poor patient for 2 to 3 months. And now we have set boundaries, like which exactly where to stay and what not to hit, and to be very careful while doing the lower face toxins. But believe me, it's very gratifying. And when you do the whole face together, carefully, of course, you can see beautiful results. And I think the best thing about toxins is it's a preventative anti-aging treatment. You can actually delay aging, you can actually delay the lines that are going to come. And I think that is amazing.
Right. So, from an awareness or confidence point of view that you need to build in your client, because like you rightly mentioned, it's more commonly known for the crow's feet or, you know, for this area. And now, when we are talking about newer applications, and a client comes to you or a patient comes to you, and you have to convince them because you may feel that maybe the toxin is the ideal approach for their, indication, be it in the lower half of the face. How challenging does that get for you, or has it been an easier approach for you?
To convince the
Yes,
patient? Oh,
yes, to convince the patient.
huge challenge. It's a huge challenge because of, there's so many things they are exposed to now, in the media. And actually what is sad is only the bad results come out in the media. So good, when you see a good face, like for example, you see a good celebrity, a good result on a Bollywood actress, you just feel, oh my God, she's looking so pretty, she's done, she's looking great, she's done great makeup. You hardly see the toxin which is making her look great. You hardly see the filler that's placed so rightly on that sweet spot which is making her look amazing. You don't see that. But when it's a bad result, it just hits everyone, and that, whenever my patients, whenever I recommend, they say, oh, doctor, don't make me like this, don't make me like this, so there's a lot of exposure about bad results that have come into everyone's views. But let me tell you guys that this is when performed by an experienced injector, and of course by a certified doctor, then you can see beautiful results. And if you just continue with your treatment, as I told you, this is one way, this is one weapon you have where you can delay aging. So when my patients, they come to me, they when I explain to them about this treatment, and first of so many are actually mortified. Oh my God, at this age, I mean, why should I start at 40? So so let me tell you, the later you start, when your lines get static, when all you have is lines, even when you don't express the lines, that time toxin is not going to work. Toxin only works on dynamic lines. So take advantage of it while it's still dynamic, because it's not going to work when it's static. And there are many patients who ask me if I have got it done. Of course I have got it done. So at 52, if you don't see lines, I have been doing it for a very long time, and I'm not ashamed, I'm not embarrassed to say that. Why should it be? It happens to be one of my favorite treatments.
Wow, wow, very nice. Also, like you also mentioned, for some indications, there could be a surgical approach, there could be a non-invasive approach. Of course, in non-invasive, also toxins is what we are talking today, but there could be several others. How do you decide that toxin is the right way forward for a particular patient? So, how do you make that choice? Any particular factors that you take into consideration?
So toxin has its own place in aesthetic dermatology. In all these years, in the last 20 years that I have started doing toxins, nothing comes close to this. There's placement. So we just read about it, there's topical things that come up. Probably you can you can do RF, there's so many, but nothing close to it. It actually depends on what the patient is looking for. If
Sorry, your voice is breaking again.
Okay, is that okay now?
Yes.
I think this some network issue. So
Yeah.
really it all depends on what the patient's concern is and how much result is he or she looking out for. If the patient is specific about saying that, doctor, I have this bad frown, I want to get rid of it, even when I'm not thinking anything, I get the feeling that I appear very, very tensed, I appear very nasty, I appear very mean to others, and I want to get that unpleasant expression out. Now, if the patient has this concern, I can't do anything but toxin, because nothing else will come close to it. If the patient doesn't want these forehead lines, if the patient wants a pleasant looking appearance, you have to add toxin to the armamentarium of whatever other treatment you're going to do. And I think if you explain to the patients properly and explain to them what magic this treatment can create, I think the patients do listen, and they do get along, and they do understand what I'm talking about.
Right, right. Every treatment has an aftercare also, right? Like something you need to maintain about it, especially for a couple of days post the treatment. So, of course, we know when we do treatments in summer, sun becomes one element that you need to really protect your skin from as soon as you step out of the clinic. Considering that now, while you and I speak, we are in the monsoon season. Is this an ideal time for patients or clients to, opt for advanced toxin treatments?
Yeah. So the aftercare of toxin is not too, it's not like you for months or weeks, you know, you have to take care. It's just like what we usually say is like post procedure, you don't have to apply makeup, you don't have to wipe off the antibiotic cream for some hours that we have applied. Don't go and exercise immediately, don't go and lie down immediately, because we have deposited the medicine in specific muscles and it should stay there. It should not uh, it should not be deported to other muscles, kind of. So, and for 2 to 3 days we tell the patient not to apply too many products on the face, just to be careful, and no massaging for a week, no salon visits for a week, and no using of home equipments like gua sha or whatever they're using, tones. So everybody has now access to these kind of small LEDs, small machines at home. That we had one patient who did this treatment with us, and in spite of telling her,
Losing your voice again.
okay, so in spite of us telling her about the post care, she went and did this machine which had these vibrations and all, uh, so she came back with a drop, and that's why I had to explain to her, that you are moving the toxin away from the muscle that
Right.
I have affected. So you have to be you have to carefully make them understand, and tell them this is serious business. You just can't go and do whatever you want, at least for a week. But monsoon is a great time to do, I think, all treatments, because the sun is not so bad, and because of the monsoon you might not be having so many socials, and while you are at home you can make the most of it.
Right, right. Any kind of trainings that, practitioners need to undergo to be able to do these new toxin applications effectively?
Yes, I think without proper training, one should not start toxin, even if it's for lower face or upper face, whatever. Because as I told you, that it may look easy, but you have to get your anatomy through, and you have to do proper training from proper centers, from proper conferences, workshops. Now we have so many proper conferences with great teachers who teach us, great injectors all through the country. You don't need to go to US or any other place. We have enough in our country, and I think Indians have the best teachers, the best injectors, from whatever I have seen, even the best speakers, I think, because sometimes whenever I go to these fancy conferences, most of the times I don't understand the accent, and there's so many other issues. And I come back thinking, oh my god, my Indian speakers are far better and the teachers are far better, and we have everything that we want. But make sure that you get thorough knowledge, you do some proper training, and then only get into your patients.
Can't agree more with you on that. Thank you so much, Dr. Geeta. I think this session was important for us to, of course, discover the various areas where toxins can be applied. At the same time, I think the subject is broader for us to only give it 20-25 minutes. So of course,
Yes.
I'm sure if you and I had to sit over a cup of coffee, we would be talking over this topic for hours. So
Yeah.
for everybody watching us, if you have any questions, even we are going to be saving this live, so you could even leave your questions after the live, and I would definitely take Dr. Geeta's time, and we would answer these questions for you all. But I will bring this live to an end now with this, and I have tried my best to ask Dr. Geeta, all the possible questions that would help us effectively cover this topic. So, Dr. Geeta, if you feel I have missed out on any important aspect that you would like to mention before we conclude the live, it's your time now.
Yeah, I think you've covered most of the related stuff, but let me tell you what is new, what is coming in the field of
Yes,
toxin. So,
yes.
Yeah, so there's one brand that is, we call it the liquid toxin. So here we have to reconstitute it. It comes in a powder like or a stain like thing which on in the bottle. But now we should shortly be getting liquid toxin. You don't have to reconstitute, and you can keep it in your fridge for till you finish the vial. You know, once you reconstitute it, ideally you should consume the vial in about 2 to 3 days, or maximum in about a month. We do keep it for a month, but we should be consuming it as far as possible. And also we are shortly getting a toxin which would the effects would stay for about 9 months. So this is like 4 to 6 months, but now we're looking for something that would last for 9 months, which I think should be amazing. But at the same time, we have to be more careful because the toxin would take 9 months to wear off. So if you go wrong, then then only God save us. And well, I just have bought a machine like a year back, which is mainly for improving the tone of the face muscles. So it's mainly for my patients who don't want to get into injectables for whatever their personal reasons.
Yeah.
So it's like a face, it's like a face gym. It helps you tone up your facial muscles. So what I have seen, just in case if there's something that, on my part or on the patient's part, if anything goes wrong, and you get a kind of adverse events, we do this machine on the patient, and we do get back the tone and the contractions, help us to remove the toxins fast. So that is something that is very encouraging. Just in case if there's any issue, we can handle it in a much better way than before.
Perfect. So I think that was a great piece of information for us to conclude with, actually. But yes, Dr. Geeta, leaving the rest of the Sunday to you. Once again, thank you so much for joining us on AM Med Talk. We are going to be doing this every Sunday at 11 a.m. and I am going to only try my best to get experienced dermatologists like you and any other aesthetic practitioner who's an expert in any other area, a certified expert who can come and join us. Also, subject matter experts, where we would be focusing on, say social media has become so important for you all in your practice today, or for that matter, HR practices, managing finances, franchisee clinics, a lot of topics, and where we would, or medical legal for that matter. So we would even look at subject matter experts in those areas going forward. So definitely we're going to only build AM Med Talk as we go forward Sunday to Sunday. Yes. So thank you so much. And for everybody watching us, like I always say, this is Shriyal Setumadran signing off the live with Dr. Geeta Patel. Thank you so much and have a great day.
Bye, everybody. Have a great day.
Bye. Have a great day. Bye.